Okay, so do not take aspirin if one not recommended by your doctor or pharmacist. So for this medication, uh, it has some serious side effects. So you should not take it if it's not recommended by your doctor. Number two, if there is no clear indication, for example, the clear indication including, take aspirin for your heart, for your atrial fibrillation, or for stent, protect the blood clot due to stent insertion. Excuse me. Um, so I would recommend that you should check to see if you have any clear indication for your aspirin. Number three, do not take aspirin if you have any active bleeding, like GI bleed or stomach bleed, nose bleed, or blood in the urine. So any active bleeding, should you may need to hold your aspirin. And of course, talk to your doctor or your pharmacist uh, if they have any further recommendation. You know, if you are taking anticoagulant like warfarin, Aliquid, or Xarelto, you need to make sure that if you have to take the aspirin, usually baby aspirin, while you're on the warfarin or Aliquid or any type of anticoagulant, or even the antiplatelet like Plavix. So these medication have the coagulation effect. So make sure you check with your doctor or pharmacist to make sure um, if you are required to take aspirin while you're on the blood thinner medication or not. Or if you are taking the baby aspirin or the regular dose aspirin, the 325 milligram aspirin, then you need to talk to the doctor who give you a new blood thinner medication, um, like warfarin or Aliquid. Talk to them to see if you still have to continue the aspirin while they start you new blood thinner medication, warfarin. And do not take aspirin if you're allergic to it. May have some kind of uh, bad reaction. Uh, it's very dangerous to allergic aspirin. So this is very important information uh, for you as a patient to know that um, why you should not take the aspirin, or why you should not continue to take aspirin uh, when you have a new medication such as new blood thinner medication like warfarin, Aliquid, or Badaxa, or Plavix. All right. So, any question, concern about this topic, please let me know. Thank you. All right. So the next medication, uh, the Motrin. This is also available over the counters at the pharmacy like CVS, Walmart, or Walgreens. So you can buy over the counter, or uh, can get prescription from your doctor. But you should not take Motrin uh, or ibuprofen if it's not recommended by your doctor or pharmacist. And you should not take the Motrin if you are on empty stomach. You don't have any food in your stomach. May cause problem, stomach ulceration, or bleeding. So make sure you eat before you take Motrin or ibuprofen. If you have major stomach or kidney problems, you should check with your doctor or pharmacist before you take the Motrin or ibuprofen. So, major stomach problem like peptic ulcer or uh, gas- gastric uh, problems, or heartburn, or uh, GI bleeding or stomach bleeding, blood in urine, or kidney problems. Like you uh, have the kidney dysfunction or renal problems. You need to make sure you talk to your doctor or pharmacist before you take Motrin or ibuprofen. Hey, so if you are taking warfarin, uh, blood thinner medication like warfarin, Eliquis, Xarelto, or Badaxa, etc., uh, you should not uh, start the Motrin or ibuprofen. If you have, headache or back pain or toothache, things like that, you may try some Tylenol instead of Motrin. Because Motrin may increase the bleeding risk when you are on warfarin or Eliquis or uh, any platinum medication. So, and if you um, taking Motrin or ibuprofen, you've been taking Motrin or ibuprofen, then you should talk to your doctor who give you new platinum medication like warfarin or Eliquis or Badaxa. Should let them know you're on the Motrin to avoid any increased bleeding risk. And you should not take Motrin or ibuprofen more than 4,000 milligrams per day. If you take more than that, it might cause uh, very serious side effect like stomach ulceration or bleeding, and it may damage your kidney. So make sure do not take any, uh, do not take more than 4,000 milligrams of Motrin or ibuprofen per day. And you should not take Motrin or ibuprofen if you're allergic to it. This very important information. If you have been taking Motrin or ibuprofen, or if you will take Motrin or ibuprofen to pay attention to this info. Very, very important. If you don't follow uh, the recommendation from your doctor or pharmacist, you might have problem with medication. Most of people have stomach ulceration because they didn't take the medication correctly. They take on their empty stomach that easily cause stomach ulceration, and it might damage your kidney. You take too much Motrin, like overdose of for more than 4,000 milligram a day, and you may have some kind of bleeding, maybe dendritic bleeding when you take with warfarin or Aliquis or any other blood thinner medication. All right, so this excuse me, this is very important information. I hope that you um, should pay attention of this information before start or uh, stop the medication. The Motrin you may take as needed. You don't have to take it every day. Just take as needed for your pain. And this is the non-inflammatory steroid medication. The non-steroid inflammatory medication, NSAID, they call NSAID. The, usually, a Motrin they take something for your swelling pain. When you get your toothache and you have swelling gum, or you have back pain because swelling or inflammation on your back, commercial cramp, things like that, Motrin may help a lot compared to Tylenol. You know, if you are taking the blood thinner medication, then you should avoid Motrin. Increased bleeding, and it may affect your kidney function. All right, thank you. All right, next medication I would like to share with you is Tylenol. Do not take Tylenol if not recommended by your doctor or pharmacist. I know if somebody just go to the pharmacy store and buy some Tylenol over the counter, if they have my headache or uh, my fever or uh, other general pain, but you know, yes, you can do that, but if you don't have any additional medical condition or uh, if you know don't know how much you should take, uh, things like that, then you need to ask your doctor or pharmacist to make sure you understand clearly before you take any medication over the counter. But you should not take Tylenol if you've been drinking too much alcohol. Drinking too much alcohol, it may affect when you take with Tylenol, it might affect your liver. It take your liver, affect your liver, and then it may cause bleeding if you drink too much alcohol, drinking too much alcohol. Uh, and you should not take Tylenol if you have any major liver problems like active hepatitis, cirrhosis, or liver disease. So you should not start Tylenol without checking with your doctor or your pharmacist, as it may uh, affect your liver function. And then do not take more than 4,000 milligram a day. If you do so, it may affect your liver. Very important, you know the dose. How much you can take a day for a Tylenol. So Tylenol generally is safe to take if you don't have any liver problems, if you're not drinking too much alcohol. And if you are on, uh, blood thinner medication like warfarin or or Aliquix or Daxa, it's okay for you to take Tylenol. It's safe to take compared to all the pain relief medication. Okay, so uh, and then the last one is you should not take Tylenol if you're allergic to it. So the very important information about Tylenol, when and what you should take, and then what you need to pay attention, precaution. Make sure you are take the medication safely. All right. If you have any question about Tylenol, please let me know. Thank you. All right. So the next medication, uh, the fish oil, omega 3. So the omega 3 for fish oil, you can buy over the counter. And it's generally safe to take, um, but I would recommend that you should check with your doctor to make sure you take it correctly. Okay? And I would not recommend that you should take the fish oil if it being expired. Now, you should make sure that it's not expired, so you take the good product. Um, if it's expired, it may cause problems. When it's expired, it's no longer effective like it should, but it increase side effect, like bleeding or cramps or nausea, things like that. It's the main side effect or bad taste, bad smell. It may contain harmful bacteria. When it's expired, it may leaking or broken. You may experience some bacteria. And some research uh, indicate that it may lead to increased risk of cancer. Expire. So make sure you check the expiration day and take it correctly. Also, uh, you should store the medication in the appropriate location. Not too cold, not too hot. Make sure the medication uh, work like the way it should. You should not take the fish oil if you have any active bleeding. So the stomach, you have stomach bleeding or nose bleeding, blood in urine, cough of blood, or if you have uh, after you take fish oil, you have bleeding or you have any kind of uh, dark or hairy stool, then you may need to stop taking fish oil. And you should not start when you have any active bleeding. That's very important because fish oil itself may increase risk of bleeding, may cause bleeding. And you should not take fish oil when you uh, taking warfarin and having critical or elevated iron level. If you have iron level about 5 or 6, it might very dangerous when you take fish oil. It might increase risk of bleeding. And you should not take the fish oil. You taking other platinum medication like Aliquid, Eroto, Adaxa, or the antiplatelet like aspirin or Plavix have bleeding or low hemoglobin. Those uh, uh, factors very important to consider whether or not you should uh, taking continue taking fish oil or start the fish oil. So if you have any of these factors, you need to check with your doctor or your pharmacist to make sure that you don't do any uh, increased risk of bleeding problems. And then if you want to take the fish oil, you should not take more than 2,000 milligram a day without clear indication. If somebody have some sort of increased cholesterol, then they might take about 2,000 milligram a day. But if you take more than that and you don't have any clear indication or recommendation, then you should not because it's increased risk of bleeding or it may have other side effect. So I would recommend that you should check with your doctor if you want to take more than 2,000 milligrams of fish oil a day. And do not take fish oil if you're allergic to it. Okay? This is very important information, and not a lot of people know about this. I've been working on anticoagulant for a long time, dealing with this supplement a lot. I recommend you should check with your doctor and your pharmacist if you have any active bleeding or if you be platinum medication to make sure you are safe from bleeding. And you should not take this medication when it is being expired. And then um, when your iron is very high, like critical level or elevated, just stop taking fish oil or do not start or eat a fish oil supplement or over the counter. All right, if you have any question about this over the counters, this medication, please let me know in the comment. Thank you. All right, so next medication is warfarin, Coumadin. When you should not take warfarin. You should not take warfarin. It's not recommended by your doctor or or pharmacist. Okay. Um, if there is no clear indication for you to take warfarin, clear indication like deep vein thrombosis, pulmonary embolism, uh, pure fibrillation, or AFib. Uh, this is a very clear indication warfarin accumulate. You should not take any active any warfarin if you are or if you have any active bleed, like stomach bleeding, nose bleeding, or blood in urine. Did not uh, start warfarin. You have active or significant or major bleeding. Um, you should discuss with your doctor or your pharmacist to make sure uh, they give you the right doses, or they start with a lower dose instead of normal or higher dose, because the warfarin dosing is very complicated. Make sure you let your doctor and your pharmacist you have active bleeding or you have history of major bleeding about the warfarin. And if you have been taking warfarin and you should have the active bleeding, that you need to report to your doctor. Make sure they stop it. And if you have life-threatening bleeding, then you need to stop warfarin right away and go to emergency for further evaluation. And you should not taking warfarin with other platinum medication like Alaquip, Xarelto, Adaxa. They are uh, platinum medication. You should applicated medication. If you about switching from warfarin to Alaquip or switching from the other platinum medication to warfarin, then you know there may be some overlap for a few days. For example, if you switching uh, from uh, Alaquip warfarin, then you need to overlap the Alaquip and warfarin for 3 days, or you stop the Alaquip to make sure warfarin start working in your body after 3 days, like that, but not taken together in a daily basis. So your to prevent your blood clot or stroke. And when you on warfarin, or you are new to warfarin and you've been taking the Plavix, and you should check with your doctor to make sure if you still continue uh, the antiplatelet like Plavix or aspirin. You need to check to make sure uh, you still need to take Plavix or aspirin. And if you have been taking and if you've been taking warfarin and they just start a Plavix or aspirin, then you need to let them know you're on warfarin to make sure uh, you know the Plavix or aspirin they want to start still need it. Sometimes it's not. And sometimes they don't know if you are on warfarin or platinum medications. They just start you with the aspirin. Some people have to be on both Plavix or warfarin or aspirin and warfarin because they have different indications. Make sure you check with to to make sure you don't have to take the medication that not take prevent suicide. You should not take warfarin if you're allergic to. And then one more thing for the warfarin. So typically, you should hold 4 to 5 days prior to the major surgery or procedure. You know, uh, colonoscopy, knee replacement, or multiple dental extraction. So you should hold 4 to 5 days prior to procedure. That normally, and presuming that uh, presume that that your INA level is at therapeutic level, and if your INA level, at the supra therapeutic or out range, then we'll have uh, hold your INA. Hold your warfarin accordingly. So that is different topic, very complicated. And then after the procedure, then you ask the surgeon or the proceduralist to make sure that if it's okay to resume your warfarin, maybe 1 day or 2 days after the procedure, if no bleeding. So I would recommend patient to check with the surgeon or the doctor who performed the procedure, make sure when it's okay to resume warfarin. So this very important information for people who have to take warfarin or who have been on warfarin. And uh, when you should report to your doctor, and when you need to go to the emergency room because of bleeding, side effect patient. And you know when you taking the warfarin, then what medication you should avoid. Check with your doctor or pharmacist every time you have a new medication, including over-the-counter herbals, vitamins. Uh, check for the drug interaction. That many drugs interact with warfarin, either decrease the efficacy or increase efficacy. Both uh, affect warfarin and affect your body. So, that you check with your doctor and when you have uh, any kind of bleeding, you need to report to your doctor, or even you just have abnormal bruising, to check with your doctor. You might have too much warfarin in your body, and or you may have take or eat any food that increase iron or increase bleeding risk. Make sure you report to you. And pay attention, and sometimes they switch you to a new blood thinner medication, Aliquix, Geroto, then you may need to stop warfarin when you start a new blood thinner medication like Aliquix. And make sure that uh, you stop the warfarin if as instructed before any major surgery. Otherwise, they have to postpone your surgery or procedure. You have to wait for a long time. All right, so that is some information that you need to pay attention when you taking warfarin or you have to warfarin. Have any further question or want to clarify anything? Please let me. Thank you.